When I got up in the morning, I was looking forward to getting on the X10 because I knew every day I was making progress, and that was getting me back to where I was with a full range of motion. I'm 60 years old, been very active just about all my life. I was a policeman for the Warren Police Department for 25 years. Retired after 25 years of service in 2002. Back in mid-December of 2013, I noticed my left knee was causing me pain. It came on very quickly. We did the surgery. Right afterwards, within 3 or 4 days, I got an infection. Scar tissue began to accumulate. The scar tissue got to the point where it really restricted my movement, where I could not flex my leg beyond 70 degrees, no matter how much therapy I was going through. And I asked him for the next step. I says, can we do a manipulation under anesthetic? He goes, okay. That was scheduled for April the 1st. Did the manipulation. Afterwards, my range of motion didn't increase at all. I was still stuck at 70 degrees. My therapist told me I would have had a permanent limp because I couldn't extend my left leg. Because of that, that threw my spine out of alignment. That was causing me hip problems. I was having pain in my hip, my lumbar area. He says, you can't spend the rest of your life like that. And I said, yeah, you're right, I can't. And that's when I heard about Dr. DeClaire. So I took my x-rays, my MRI, went to see Dr. DeClaire, made an appointment with him. He shot his own set of x-rays, looked at what I had. He says, well, my opinion is you have a lot of scar tissue in there, and that's causing your problem. We're going to have to go back in there and do a revision. And I said, okay. I says, let's do what we have to do. So we did the surgery on June the 18th, did the in-home therapy for 2 weeks, and that's when I found out about the X10 machine. It's like night and day. I was pretty much on my own after the first surgery, but with this X10, I felt more confident. I could progress, and I could see my improvement on a daily basis. So that's very encouraging to a patient. I mean, with the computer console, you can set the range of motion where you want it, progress at your own rate. You can back off when you start to feel pain and then gradually go back and increase your range of motion. It's very motivating and to see your progress on a very clear progression. Well, I was in a very unique position because I could compare what I was doing with the X10 with what I went through with the first surgery. I mean, that was night and day. When I got up in the morning, I was looking forward to getting on the X10 because I knew every day I was making progress, and that was getting me back to where I was with a full range of motion.
X10, back to full strength.